Welcome to Practice Pearls. I'm Dr. Neil Skolnick. Joining me to discuss when to think about insulin therapy and diabetes care is Amy Butts. Amy Butts is an endocrine physician assistant at WVU Wheeling Hospital in Wellsburg, West Virginia. Welcome, Amy.
Thank you, Neil. Thanks for having me.
Amy, can you discuss some of the barriers that our patients face when initiating insulin therapy?
Sure, absolutely. So I would say fear is at the top of the list when it comes to barriers for insulin therapy, whether it be fear of injections themselves, fear of hypoglycemia, or fear of failure, failing their provider, or even feeling like they failed themselves. I would say cost is also at the top of our list these days as far as a barrier for many patients, as well as burdensome therapies such as injections, sometimes 4 times a day, basal bolus.
There are a lot of barriers for patients. What are some of the barriers for providers when thinking about initiating insulin therapy?
So I think time. We are all very busy these days. There are many patients, and we need to provide care to them, which limits time. And insulin therapy requires time to teach and educate with intensifying and initiating. And that often is what we don't have. And we don't have that support staff often that we can use in our offices to teach patients as well. And we tend to let our patients convince us to give them another chance or second chance. And that definitely tends to delay intensification, and clinical inertia then ensues.
So there are patient barriers, there are provider barriers. Are there strategies for overcoming those barriers?
Sure. I think we need to think team. Treating diabetes is a team-based approach. We need to have our patients be part of the team, as well as outside providers, such as certified diabetes care and education specialists, registered dietitians. We also, as providers, need to continue to educate ourselves on the current standards in initiating therapy. ADA every January publishes their standards of medical care, and we have great guidelines on initiating and intensifying basal insulin, as well as initiating prandial insulin when it's time to intensify in a stepwise approach.
That's fantastic. So we have barriers for patients, for physicians, and now some strategies to use to overcome those barriers. Amy Butts, thank you so much for joining us.
Thank you, Neil.
For the American Diabetes Association, I'm Dr. Neil Skolnick. For more information on overcoming barriers to initiating insulin therapy, as well as other topics that impact our patients' lives, just go to the link below. And until next time, stay well.